Hi, my name is Natalie.
My name is Coriana.
My name is Marissa.
My name is Alicia.
And we are youth leaders with Caffey and Associates Public Health Foundation. We are a part of a youth tobacco and vaping prevention program called BU. Our goal with the BU program is to educate and engage you about tobacco and vaping prevention information. So far, we began our program with the pre-survey, completed 3 Tobacco and Vaping 101 presentations, and 3 tobacco and vaping activities to reinforce this initiative. Today, we will complete our task with Tobacco and Vaping 101. We will review what is tobacco, risk of smoking, cancer-causing chemicals, nicotine, you are the target, nicotine delivery model, smokeless tobacco, electronic cigarettes, outreach campaigns and vaping, and resources to quit. What can go wrong, co-create, and hack the system. Coriana, will you please educate us on health risks and consequences?
Absolutely. Session 4, Health Risks and Consequences. Health effects of tobacco use. Low IQ, lack of concentration, inhibition of the natural feel-good receptors, brain stroke, brain shrinkage, and much more. Health facts. Smoking is a cause of rheumatoid arthritis. If nobody smoked, 1 of every 3 cancer deaths in the United States would not happen. If you quit smoking, your risk for cancers of the mouth, throat, esophagus, and bladder drop by half within 5 years. Quitting smoking cuts cardiovascular risk. If 1 year after quitting smoking, your risk for a heart attack drops sharply. Smoking can increase your risk for cataracts, clouding of the eye's lens that makes it hard for you to see. Here are a list of parts of the body smoking affects. Smoking can cause cancer almost anywhere in your body. Short-term effects: increase in blood pressure, increase in heart rate, increase the flow of blood from the heart, increase the effect of irritants on any standing allergies, increase in acid in the stomach. Long-term effects: chronic lung disease, coronary heart disease, stroke, cancer of the lungs, larynx, esophagus, mouth, and bladder. Consequences of smokeless tobacco: cracking and bleeding lips and gums, receding gums, increased heart rate, blood pressure, and cancer. Secondhand smoke, also known as environmental tobacco smoke or passive smoke, is a mixture of 2 forms of smoke from burning tobacco products. Side stream smoke, smoke that comes from the end of a lighted cigarette, pipe, or cigar. Or mainstream smoke, smoke that is exhaled by a smoker. Consequences of secondhand smoke. Secondhand smoke is the 3rd leading cause of preventable death in the United States. Heart disease, lung cancer, sudden infant death syndrome, SIDS, low birth weight, frequent and more severe asthma attack, bronchitis and pneumonia, increased risk for ear infections, increased risk of cervical cancer. There is no safe level of exposure to secondhand smoke. COVID-19 and tobacco. Certain groups of people are at higher risk of getting seriously sick from COVID-19. If you smoke or vape, you are one of them. This means it is even more important for you to take steps to protect yourself from the new coronavirus. Join the COVID-19 Big Quit. Smoking can weaken your immune system and put you at a higher risk of severe illness or death from COVID-19. You are irreplaceable. To make a plan to quit vaping or smoking, call 1-800-QUIT NOW. How can you help your community? Allocate resources, think long-term, recognize the contributions of the community, help build community resilience. Resources to quit are listed on your screen.
Now that we have gone over what is tobacco, risk of smoking, cancer-causing chemicals, nicotine, you are the target, nicotine delivery model, smokeless tobacco, other tobacco products, electronic cigarettes, outreach campaign and vaping, and resources to quit. Let's play a little game called Stick to the Facts for the next 5 minutes. We will learn the myths of tobacco use. I will read the myth and we will discuss how to turn the myth into a fact.
Myth 1. Only a small amount of dangerous toxins can be found in tobacco smoke. In fact, the number is closer to 250. These harmful chemicals, at least 70 of them, have been proven to cause cancer. A list includes arsenic, formaldehyde, nickel, and chromium. The other 180, such as carbon monoxide, ammonia, and hydrogen cyanide, are harmful to the human body in other ways. Myth 2. Smoking cigarettes only causes lung cancer. In fact, even though lung cancer is the most common cause of cancer death in both men and women, estimates are that a quarter of the tobacco-related deaths yearly in the U.S. are from lung cancer, heart disease, chronic obstructive pulmonary disease, other tobacco-related cancers, and less common harmful effects such as premature birth and house fires are also attributed to smoking. According to the National Cancer Institute, the following cancers can result from tobacco-related causes: esophagus, throat, larynx, mouth, kidney, bladder, liver, stomach, pancreas, cervix, colon, and rectum cancer. Simply put, smoking has been found to damage nearly every organ and organ system in the human body. Myth 3. Cigarettes and tobacco smoke causes 100,000 premature deaths per year in the U.S., which is 3 times more than the annual deaths caused by cars and guns combined. Well, in fact, the death toll is 5 times that. While it's true the annual motor vehicle and gun-related fatalities, which each tally around 33,000 deaths per year, pale in comparison. Close to 500,000 people die prematurely every year in the U.S. because of cigarette smoking and exposure to tobacco smoke. Of those deaths, about 36%, approximately 173,000, are from cancer. Smoking retains its spot at the top of the list of most preventable deaths in America. Myth 4. Other types of tobacco products, such as e-cigarette vaping, are not harmful the way cigarettes are. Here are the facts. Everything from pipes and hookahs to snuff and cloves have been shown to cause or increase the risk of lung cancer, throat cancer, mouth cancer, heart attacks, and other lung diseases. Myth 5. Because of medical advances, the risk of a smoker developing lung cancer has decreased in recent years. In fact, over the last 50 years, the risk of lung cancer and COPD, including frequent bronchitis and emphysema for smokers, has actually increased, even as the number of cigarettes consumed per smoker has decreased. Myth 6. The primary risk to pregnant women who smoke is premature delivery. Here's the fact. Smoking makes it harder for a woman to conceive, but then it also increases risk of miscarriage, ectopic pregnancy, low birth weight, and cleft lip or cleft lip palate. Sudden infant death syndrome also becomes more likely when a woman smokes during or even after pregnancy. Myth 7. Smoking makes you look mature and attractive. Here's the real fact. The more cigarettes you smoke and the longer you smoke, the more skin wrinkling you are likely to have. Aside from age, smoking is the strongest predictor of facial wrinkling in men and women. Men who smoke have a greater risk of erectile dysfunction. Myth 8. Non-smokers cannot get cancers from tobacco smoke. In fact, secondhand smoke is a carcinogen, and inhaling it can cause lung cancer in non-smokers. Living with a smoker increases a non-smoker's chances of developing lung cancer by an estimated 20 to 30%. Approximately 7,300 non-smokers die every year in the U.S. from lung cancer caused by secondhand smoke. Myth 9. Once a smoker has smoked for a while, his or her system is already permanently damaged and nothing can reduce the damage. The fact is, quitting produces immediate results for most smokers. Within days, weeks, or months, heart rate and blood pressure returns back to normal levels. Circulation and lung function improve, coughing declines, smell and taste get better, and life expectancy extends. Myth 10. A smoker who has been diagnosed with cancer would not benefit from quitting. Actually, in fact, for some cancer patients, quitting smoking can decrease the risk of death. It also reduces the risk of developing other dangerous health complications as a result of a weakened immune system, and it makes it easier to heal and recover from treatments such as a surgery or chemotherapy. Quitting may also help prevent the cancer from reoccurring or prevent a second cancer from developing.
You guys have done an outstanding job. We have now ended the education portion about tobacco and vaping. When we meet again, we will show you how you can be an advocate against tobacco and vaping usage. Thank you for your time and enjoy your day.